The content herein is for informational purposes only, not intended as medical advice, diagnosis, or treatment, and is not to be substituted for direct advice from your doctor. Today's show is sponsored by Omni Therapy Center, LLC. Established in 1987, Omni Therapy Center has provided the local community with quality physical therapy services, including lymphedema, lipedema, and many related lymphatic disorders. The proprietors, Anna and Oscar, are therapists and certified in lymphedema therapy. In 2022, they received the designation National Lymphedema Network Expert Clinicians from the National Lymphedema Network. They are located in Bloomfield, New Jersey at 973-429-0890. For further information, please visit omnitherapycenter.com. Welcome to LymphCast, the show that brings together doctors, other health professionals, and special guests to discuss lymphedema, venous disease, and other associated disorders, and what can be done if this is affecting your life. Now it's time to sit back, relax, as it's time to learn all about lymphedema, venous disease, and associated disorders on our show, LymphCast. Greetings and welcome to episode number 8 of LymphCast. Glad you're with us today. Let's introduce our panel and our special guest coming up, but we'll get to her in just a moment. The originator of the show, the man who put it all together, also involved with Vital Support MD, from New Jersey, physician surgeon, Dr. John A. Chuback. Greetings, Dr. Chuback. How are you today, sir?
Greetings, everybody. I'm doing well, doing fine. Looking forward to a great show with an old friend and a familiar face.
All right. Did you want to explain the headwear now, or do you want to save that for later? It's up to you.
Oh, sure. Some of our viewers know I always wear my Stars and Stripes American cap, but This cap, my maple leaf cap, was a beautiful gift from today's guest, Amanda Sobey, and I've had it a long time, and I wear it with great pride, especially when I have Canadian and French Canadian patients and so forth in my practice and in my office, which happens fairly frequently. So it's a treasure. It's near and dear to my heart, so I thank her once again for that thoughtful gift.
All right, very good. Let's welcome from Arizona, Dr. Monika Gloviczki. Greetings, Dr. Gloviczki. How are you today?
Hi, hello to everybody. I'm doing fine, and I'm so happy and excited to have with us our guest, Amanda Sobey. And I'm looking forward to our podcast discussion about lymphedema.
All right. Why don't you take it from there, Dr. Gloviczki? Introduce Amber. Tell us a little bit about her, and then we'll turn her loose, and she can tell us her story and all the good things that she's doing.
So I will do just very brief introduction. Amanda Sobey is a wonderful young Canadian woman who happened to have a problem with the lymphedema as a patient, and who turned out this medical issue into the huge advantage, because she became the advocate for treatment. She became a coach for lymphedema treatment. She constructed very thoughtful Amanda Sobey wellness program, which helps many patients to deal with this disability. So without any further comments, I think I will turn to Amanda and let her tell us her story.
All right.
Thank you.
Yeah, take it from there.
Thank you, Monika. Get so excited over here. I super apologize, but thank you for the introduction, and thank you so much for having me part of the LymphCast series. So a little bit about myself. I'm currently 40 years old, 40 years young, I should say, and I've been dealing with lymphedema for just over 20 years now. So when I was diagnosed, I think I'm kind of rare in the fact that I was diagnosed very early on with my condition. I was grateful to have a lymphoscintigraphy and grateful to be diagnosed with lymphedema. I don't know if grateful would be the best word that I would use at that point in time, but being diagnosed with this incurable condition, again, 20 years ago, the interweb was not as robust as what it is now. So the information that you found on lymphedema was very devastating, heartbreaking, incurable. And it was a very sad time in my life because there was no path or there was no promise that you could actually live a happy, healthy, normal life with lymphedema. So being diagnosed with lymphedema back in 2001 was a very, very hard time because all that we knew was to wear your compression garments and go for manual lymph drainage. And I think a lot of the listeners would attest that, you know, there's not a lot of financial coverage with regards to this condition. So everything that you do need is out of pocket. It's pretty much all private funding that you need to take care of this condition. Even though that I'm in Canada, my condition was not covered or even recognized by the government, which further spearheaded my advocacy efforts and just my spokesperson of just getting information into people's hands, connecting with, you know, experts and elite doctors, and getting all of us to work together to promote a better image and a better voice for patients with lymphedema. And I hope to obviously do my best at showing people that you can live a very happy, normal, healthy lifestyle with lymphedema.
All right, open it to questions. Either Dr. Gloviczki, Dr. Chuback, take it from there.
I just wanted to ask you, you know, about this incredible journey of yours. How long it took you to, in a way, to take yourself, you know, in charge of your destiny, and to learn all about the disease, all about the potential treatment, and how hard the process was?
That's a very good question. So I'll try to be as thorough as possible. So when I was diagnosed in 2001, it was very devastating. So as soon as I got the diagnosis of that there was no cure, I immediately went negative. I went in a downward spiral. I wasn't compliant. I was not living a very good lifestyle. I really did think that my life was over because any of the information that I had seen were pictures of elephantitis and pictures of people that would just sit there with these huge legs. And being 20 years old and trying to get my head around the fact that my leg was going to be so enormously large and there was nothing that I could do to stop it. That took me about 16 years of depression. And just, you know, I did try to study, I did try to research, I did try to, you know, link out with more doctors and get more information. But every time I tried to reach out, a door closed and then another door closed. There was no windows to jump through. So it was just a very sad, isolating, debilitating time in my life. So it was 16 years of just bad news over and over and over again. And then in 2016, I kind of had a moment. It was a big moment where I guess the only way to explain it was I hit rock bottom. And it was that moment, that turning point, that I'm either going to do something about it or I'm not. And thankfully I had enough, you know, stubborn attitude and enough ambition to take the 16 years of the education and the research and the advice that I had taken over the years and just start kind of like a jigsaw puzzle, putting pieces together that I knew that were supposed to work. And it was about a good year and a half of this process of trying and failing and trying and more failing till I started to see a difference. So through that time, I was very ambitious and I was very, I, like you, Dr. Gloviczki, I love science. So I have patience to try something and to research and to, you know, have a baseline and try to get, you know, things that were really beneficial for the condition. And it took me a year and a half to reverse the symptoms of what I was experiencing back in 2016 was stage 3, stage 4 lymphedema. And at the end of my, not the end of my journey, but in 2017, I was exhibiting stage 1, stage 2, which for people who are listening, that was considered almost impossible to do back at that time. And I was told to go be part of a bodybuilding competition because I was working out in the gym every day. And I had gotten my legs very similar in the size and the dimension. And I had actually won my bodybuilding competition in 2017, which then kind of inspired me to turn my life's work into coaching. And then in 2018, it was something that I had forgotten about. I was very dedicated to nutrition and dedicated to fitness and to, learning how to do MLD and being compliant with stockings, getting good supplements, getting good things into my body. But I really didn't take care of the brain and the mental factor and just the fact that it's a mind, body, spirit journey. So in 2018, I kind of fell down again and really started to go back into like meditation and positive affirmations and deep breathing techniques, and allowing the mental side of no cure, no hope, no nothing, and started to change the dialogue to seeing the positivity, seeing that things could change. And so between the physical journey from 2016 to 2017, that was a dedication to the physical aspect. And then the journey of the mental aspect was from 2018 to 2019. COVID hit in 2020, which forced us all home, which allowed me to work on my very own program and very own course where I do teach and coach and train other lymphies of the tools that I feel aren't always told or at least shown us how to implement in our life. And so now I dedicate my life's work and my life's journey to train other lymphies how to thrive with lymphedema, and doing it all under the safety of their own roof. And then also to looking at, when do lymphatic patients want to look into surgery? When do lymphatic patients need to get more of a team around them to support their health? So again, it's not just trying to do it isolated and alone, but really getting key pivotal people who are just as educated and just as knowledgeable to help support you to make the right decisions of what's best for your condition at that point in time.
So, Amanda, I have experience. I have to tell our listeners that I went through a 3 months training with Amanda for fitness, and it was absolutely wonderful experience. But I want to share with our listeners, how do you work with either just simple people like me without lymphedema, but wanting to improve their physical condition, or the lymphedema patients? How do you organize yourself?
So I do all of my coaching online. So I am able to reach anywhere in the universe that I guess has an internet connection. So, and we don't need a lot of equipment when we get started with your fitness journey. Just to backtrack for people who may not know, the lymphatic system is powered through your muscles. The muscles are the pump to push the lymph through. And if you are in the fitness industry, a lot of people, they just think that they can just get on that treadmill and that they're going to have success, or they just think that if they go to the gym, they're going to be, an athlete. And so what I try to do is really break down movement, really targeting specialized areas. Again, if you have compromised limbs in the legs, for example, I will spend more time training my clients on their lower body movement to get the muscles to pump and to push through. Because if you strengthen the muscle will develop in over time, which will help press into the lymphatic system to help to push any of that edema that's in there. So I really love to teach the basics of movement and the basics of fitness. And once you understand the key principles, then I will obviously challenge you more and increase the intensity of your programs to not only complement where you're at, but also to diversify your athleticism and to continue to build on that strength over time. So again, for the beginners, it's just a matter of taking it to the basics, focusing on the areas that require the most amount of help, and then building on that slowly over time so that you become really strong and efficient at pushing that lymph through.
Well, that certainly works. I experienced myself on your teaching, so I can confirm that it was absolutely efficient. And whenever I exercise right now, I have always like little Amanda in my mind who is saying, "Oh, do this," or do you remember about this movement that you have to go slowly, you have to pay attention on this, on another aspect. Now, I wanted to ask you something also about kids, because this is a huge issue for lymphedema patients, women. How do you deal with with pregnancy? How do you deal with the kids, you know, globally speaking, having your condition?
So I had my condition present in 2001. I had my first child in 2005 and my second child in 2007. And through both pregnancies, it was imperative to stay active. It was imperative to eat clean, healthy foods. And it's funny how each pregnancies were very different. And I'm very much of a believer that the babies, they already know what they want to eat. So for my firstborn, I loved blueberries. I absolutely adored blueberries. And of course, I lived out in British Columbia at the time, so it was super easy to get just flats of blueberries that would sit in the front driver's seat as I'm driving around with this big belly. And then the other one, my littlest, I have to say, he when he was in my tummy, he liked a little bit more of the junk food, to be perfectly honest. But no matter what I had cravings for, it was a matter of making sure that you did take your supplements, you did drink your water, that you did stay active, you did stay compliant. Again, going for manual lymph drainage, reaching out to your therapist. I also remember wrapping my leg every day. So even though that I had my big belly, I would maneuver my body on the bed with my leg up in the air to compensate for my belly. But it's a matter of, I think the biggest thing for women and even men who have lymphedema, the best piece of advice that I could give to anybody that has this condition: don't expect to see dramatic results today, but if you practice good, healthy habits on a daily basis, it's going to make a really big outcome. And so during pregnancy time, your body is going to increase in fluid, right? Hormones are going crazy, fluid increases, everything triples, if not quadruples, based on your blood supply. So again, being true to your good daily habits and treating your body like a temple is going to make your pregnancy a lot easier than if you just sit there and do nothing. So again, if you have good habits and you practice that on a daily basis, it's going to help with the pregnancy and also the recovery period afterwards to get right back into, those habits after baby is born.
That's certainly a wonderful advice to give. And I also wanted to share a little bit about your daily schedule, because you are an extremely disciplined person. I admire, your organization and the fact that you have everything planned, like from the very beginning of the day. And may I share some details with the public?
Go right ahead.
So you start your day actually with exercises and some inspirational listening or podcast or something that is really putting you up mentally, morally. Is that true?
It is. I think a lot of people, to politely put it, nobody wants to get up and do their life regimented every single day. I do believe, though, human beings, the majority of us, we're very routine creatures. And I think what's most important is to find a routine that works for you. And again, setting your brain, setting your intentions, and setting your focus is going to help you fall in line and to partake in what is needed for you to take care of yourself. I don't know if people know, but I've been a full-time single parent for 17 years and counting. So I don't have a lot of time. I don't have chunks of time just to sit down and put my feet up. In fact, I really don't have any time at all. So I have to be very careful with what I do in my world. And I have to make sure that I'm not working harder, but I'm working smarter. So getting up and listening to positive affirmations, setting my focus and getting it in when I can really does make a difference. And like I said, it's not to see an immediate change for today, but again, my daily habits set me up to be very successful later on in my world. And now my days feel so incomplete when I'm not part of my routine. The fact that my body loves to have movement, and again, moving the lymph, moving all that stuff that builds up inside of me, movement feels so good now, where when I started my journey, it was a labor, right? It was very hard to get that discipline to keep going. But I think, like I said, just accepting the fact that every body needs a certain routine to function, and you have to find what works for you. And this is my schedule. I'm very much of a morning person, so I like to get my self-care habits done first thing in the morning, so then everybody else comes after. And I just find that that's my rhythm, that's my beat.
At Omni Therapy Center, lymphatic disorders are evaluated and treated. Guidance is provided to patients from over 20 years of knowledge. Staying informed about new updates and changes in healthcare is incorporated into each treatment. The therapists are certified in lymphedema treatments, research, and application to serve your needs better. They are located in Bloomfield, New Jersey at 973-429-0890. For further information, please visit omnitherapycenter.com.
I think it's really so smart and so good. And actually, I'm trying to follow your pattern in that, because they truly it's a good start of the day. And I also have to emphasize what you just said, that in fact, you are not exercising a ton of hours. It's not at all, like impossible for anybody else, like people sometimes say, oh, okay, this and this is in such a wonderful shape, but he or she is spending 3 or 4 hours in the gym, or having all the training specific, and your training is really concise, within more or less 1 hour, and
Very much so.
Yeah, it's still very efficient and giving a wonderful results, certainly.
And I think it's also functional fitness, where I tell my people, whoever's listening, I tell my clients, like, again, vacuuming, if you know how to vacuum properly using your muscles, you can push your vacuum. Like, I had to, even carrying groceries is an exercise for me. Walking up and down my stairs, I turn it into an exercise. So I might not have a full hour to work out, but I guarantee you I'm carrying something in a day. I'm walking up and down the stairs in a day. I turn everything that I do into a form of exercise. Even when I'm standing and washing my dishes, I'll give myself some calf raises just to pump that fluid. Again, I'm not devoting 6 to 8 hours in the gym. I'm a matter of taking my life and fitting things in when I can to help make my body function easier, throughout the days. So all these small little decisions, and Monika had the privilege of training with me, that mind muscle connection, if you know how to get that muscle to pump, give it a few squeezes every now and again. And everybody is so amazed with the results that they get, again, whether you have lymphedema or whether you don't, because once you start to target that muscle and that muscle starts to strengthen and starts to push into the dermis or into your skin, it's amazing how powerful it pushes that debris out of the body and finds a different pathway. So again, one of my mottos is don't work harder, work smarter. And you don't have to be a highly trained athlete. You just have to have enough diligence to be consistent on a daily basis to get the results.
Very true. Now, I would love to you to explain a little bit more about your concept of the nutrition and diet, what you developed through all those years.
So food, I think when people research food and diets, oh, it's like going down a rabbit hole. There's so much information out there, and you're always going to find conflicting information. Now, everybody is created differently, and there's going to be certain factors that are going to determine what lifestyles are good for each individual. So now, again, this could be based on genetics. This could be based on your environment as to where you're raised. Our bodies, each person may have certain food intolerances. So I think it's really important for each individual to start to learn what kind of foods affect their body first and foremost, and stop trying to follow the fads. If you have a girlfriend or a guy friend that's doing a diet, don't just follow people for the sake of the blind leading the blind. You need to get educated and understand that when you create a lifestyle, there's some key factors that I like people to learn. One would be the financial commitment, the financial aspect to having a healthy, high quality lifestyle. If you can't afford your lifestyle, I guarantee you're not going to be able to stay on it long term. So the financial investment to your foods needs to fit within your budget, not only for you, but for your family. The convenience of your lifestyle of preparing the food and making sure that it's feasible to have consistent meals ready, not only for you, but for your family, is also a factor. If you're a single parent like myself, cooking is not going to be on the list of what to do every single day. So again, finding the time to do the food prep and the meal prep on the weekends. And again, the lifestyle that you choose should be able to nutritionally feed not only yourself, but your family. I very rarely made two separate meals, like one for me and one for the kids. The kids ate what I ate. Again, they would have a few more added ingredients that I might not be able to have, but I wasn't changing my lifestyle so that it had to be so dramatic or so drastic from what was considered as normal. Another key tip is that it has to be delicious. It has to be tasty and savory and just feel like you're not missing out on anything. I think that's the world's worst thing when people do a nutritional plan or a lifestyle and it is just like cardboard. You wouldn't be happy eating cardboard. So please just make sure that your food is fully nutritious and delicious. And last but not least, you want to have a full profile of your macronutrients. And so this is where I like to teach for a lot of my clients is that food can really only be three things. It could be a fat, it could be a protein, and it can be a carbohydrate. Sometimes it can be a protein and a carb. Sometimes it can be a fat and a protein. Sometimes it has different ingredients, but at the end of the day, it has at least one of those macronutrients in it. And when you start to understand the importance of these macronutrients, you want to have a consistent supply of these macronutrients to reduce inflammation in your body, to continue to supply your body full of energy, but also to maintain the quality of the ingredients that your body needs to fuel. So diving further into your macros, I do like to have an anti-inflammatory diet, meaning I stay very low in my carbohydrate content. My carbohydrates, if for people that are listening, all carbohydrates, I don't care what it is, they turn into a form of a sugar. There's various different sugars out there, but at the end of the day, what people need to understand is that carbs turn into sugar. Sugar causes inflammation. Now, carbohydrates get really bad reputation. I clearly get very excited about talking and teaching, so here we go. Carbohydrates, when you're choosing carbohydrates, you want them to be low on the glycemic index. What this is going to be long-lasting sugars. So they're going to keep your blood sugar levels at a very moderate level, again, keeping the inflammation low. So when I tell people to eat, you know, a low-carb diet, they kind of get all panicky because they start to think, oh my goodness, I can't have bread, or I can't have this, I can't have that. But again, it's a matter of, you can have basically everything and anything, but you have to go and deal with this in moderation. So if you choose to have, you know, pasta for lunch on a Monday, don't be having pasta for dinner on the Monday as well too. Choose to have maybe, you know, meat and vegetables for your dinner portion, again, keeping that carbohydrate content low. And again, if people want to understand the science behind it, they can cross-reference this to the glycemic index, and the glycemic index will teach you how much sugar is in your foods. So base your decisions on science, not based on what your girlfriend or your guy friend is doing or what you hear in these support groups, but really start to understand the science behind food, and it's going to help you make easier choices. The body is going to be a lot happier. And it's amazing, all the times that I do nutritional plannings for my clients, they're completely amazed because their cravings go away. They're fully satisfied. They get to eat more food than they ever imagined, and they lose weight, they lose the inflammation, and their edema gets better. So what I love to teach for people is, again, learn about food. Don't just follow blindly after people that are doing whatever. Take the time to hire professionals or read these books. Again, I've created all my books on my macros. You can head on over to my website at amandasobey.com. And again, learn about the basics of how delicious and nutritious and just nourishing good food can be. And you will be very happy with the results. And again, it's not only going to help with lymphedema, but, you know, high cholesterol, diabetes, heart conditions. Food, again, can make you well, but food can make you sick. So again, it's a matter of finding a lifestyle that you can stick to, which is going to make you happy overall. And that's kind of what I love to do.
Yes, I invite everybody, and I have to say that I really adore that book that you made on the food, which is called Color of Food. And this is excellent because that makes you like playing with the with what you eat towards the really healthy habits. That's really super. And John, do you have any question or?
No, I love to listen to Amanda speak. We've known each other a long time. Her enthusiasm is infectious. Her passion is highly motivating. And I always tease her. I say, once she comes out of her initial shell, she's going to be okay when she gets over her shyness. But I tease her because she's so enthusiastic, so energetic, so uplifting. And these are all the great characteristics of a great leader. And she really has defined herself as a leader in the area of lymphedema. And she touched on a few things that we talk about time and time again on the program. And I think it's worth reiterating and bringing out once again. First of all, as a physician, as a surgeon, we recognize that many diseases, the vast majority of diseases, I would say, are chronic and progressive and incurable, with the exception of certain things like appendicitis, cholecystitis, where you can take out an appendix and throw it in the garbage, and so on and so forth. Most very commonplace diseases that we know of very well, hyperlipidemia, diabetes, hypercholesterolemia, hypertension, obesity, et cetera, et cetera, et cetera, depression, anxiety, so many chronic and very, very commonplace diseases are incurable. That being said, I think that's why Amanda is so right and so inspirational to shed light on the fact that she overcame the idea that because something is incurable does not mean that it's hopeless by any means. There are people with all of the diseases I just named who may not be curable, but they still have tremendous hope with proper treatment, proper intervention, proper self-discipline, self-regulation, self-responsibility, et cetera, et cetera. And fortunately, it's only in the end stage of certain circumstances where things become incurable in the sense of fatality. But incurability and hopelessness are not synonymous. And I think this is an excellent, excellent point that Amanda brings out. On the same token, right along the same lines, the other point that she brought out so beautifully is very early in her discussion today, she mentioned, and I've been jotting notes feverishly as I always do, that at a very early age, in her late teens, early 20s, she said, I was lucky to be diagnosed. I had lymphoscintigraphy and I was lucky to be diagnosed. And this is another thing that we have to bring out again and again and again for our patients and for our physician and practitioner listeners, that we don't want to be seeing the patient with the massive deformed limb, etc. Unfortunately, we still do see those cases, but the earlier the patient can be diagnosed and the proper diagnosis can be made and this disorder can be detected, the earlier intervention can start and the more hopeful is the outcome of this quote unquote incurable disease. The earlier we can intervene, the better. And my clinical observation has been, unfortunately, over the years, that mild and moderate cases of lymphedema and lipedema, for that matter, are dismissed in many circumstances. Well, it's just a little swelling, nothing we can do, elevate your leg, et cetera, et cetera. And patients get kind of bounced around from one physician to another, each getting the same sort of answers. So it's so essential, so imperative that patients who suspect they may have this disorder do everything they can, again, inspired by Amanda Sobey, to be dogmatic, to be absolutely unstoppable in terms of searching out physicians and other clinicians, including lymphatic massage therapists and so on and so forth, who have true expertise, knowledge, and understanding of this area so that they can avail themselves to help. Health and help. Do not be deterred by physicians who tell you there's nothing wrong with you. Do not be deterred by healthcare professionals of any kind who say this is all in your head, there's nothing we can do about it. Use Amanda as a great inspiration. Keep searching, keep Googling, keep looking for more referrals, keep looking for great resources like herself, and find a practitioner early, because anybody can make the diagnosis when it's extreme and highly advanced. But in those cases, very difficult to turn back the clock. Not impossible, as Amanda pointed out, but very difficult to turn back the clock of the clinical manifestation and progress of the disease. So the sooner we can get these patients in the hands of competent, capable people, the better. So those were a few of my just immediate takeaways from Amanda's comments. And the other thing that I would say, I would like to thank her publicly and personally, again, which I have done many times, but I'll take this opportunity to do it again. Amanda has been a great, as has Dr. Gloviczki, a great ambassador of VitaSupport MD and micronized purified flavonoid fraction, which she has used for a long period of time now. And she has referred many people from Canada, the United States, and other parts of the world for that matter, Europe and beyond, to the dietary supplementation, in addition to this very clean, healthy, nutritious diet that she is promoting. So I want to thank you once again for that.
Can I also piggyback on what you said, Dr. Chuback? I really want people with lymphedema and or lipedema to understand that it takes a team of people to offer you the best support and the best care. And it's funny because I always like to talk to my clients or my patients. What I teach my clients is and again, surgery may be an option for a lot of people, but again, what I like to teach them is the tools and the habits, not only for pre-surgery but also post-op, because what people don't understand is that it's a lifelong condition, and the things that I teach my clients not only get you really well trained or really well um, prepared for pre-surgery. Again, you want to go into surgery at the most optimal point in your life. You don't want to go into surgery being the sickest, the worst of your health. So again, making sure that you're ready for surgery is going to be your best defense with this condition. And as well, what I teach my clients not only preps them pre-surgery, but again, it also helps with the recovery period, because you're already getting conditioned, you're already leading a healthy lifestyle, and your surgeon is going to be so excited to deal with a person like you that has done the initiative to take back your own health. I hear this from, like, and I guess Dr. Chuback, you can kind of speak on this as well too, but you hear a lot of doctors will turn away patients who aren't actually putting their health in their most optimal position for the fact that they're worried about the success of the surgery. It's a collective effort. So again, getting proper coaches, getting proper therapists, getting proper doctors, and also you as the individual has to do the work. I don't want people to sit here and look at me thinking, oh, this has been so easy. It's been hard. This entire journey has been hard, but I would not change a single decision to take back my health. And again, I had to do the work. I had to get up at 4 o'clock in the morning. I had to go and move my legs. I had to get the proper tools and the proper supports in order to see what you see sitting in front of you today. But again, I want people to look at health instead of thinking it's a one size fits all. It's not, but it's also that commitment to being diligent, to getting the proper people in your corner so that you can get the proper care possible.
At Omni Therapy Center, we strive to collaborate with other healthcare providers that share the knowledge of lymphatic disorders. The treatments provided at Omni Therapy Center are the gold standard of lymphatic disorders and are known as complete decongestive therapy, or CDT. If you think that you or your patients suffer from lymphatic disorders, lipedema, or phlebolympedema, we encourage you to reach out and contact us for further information. We are located in Bloomfield, New Jersey at 973-429-0890. For details, please visit omnitherapycenter.com.
Yes, certainly, and every single element it has to help you to fight in a way.
Mm-hmm.
Be it compression therapy, be it manual lymph drainage, or the nutritional supplements like NPFF, and everything is bringing you the best chance to get better. Yeah, sure. But you are like, you know, you have to be on the top of this, because certainly nobody else will do it for you.
Yes. And
well, right. And sorry, go ahead.
No, I just pick up on what Monika is saying, and also circling back to one of my notes early on, a very, very important note, Amanda, that you brought attention to. The idea of financial coverage, insurance coverage of these disorders, beginning with the fact that and this is why we have the show. This show is a labor of love, beginning with the fact that there continues to be such ignorance in the medical community. And I don't say that in a disparaging or pejorative way, just ignorance in the purest form of the word. People do not know. Doctors are not aware of what they're seeing when they see it. And too often, if a doctor is not in a position to make a diagnosis based on their own clinical judgment, physical examination, et cetera, they disregard the entity and dismiss it as unimportant or not a real disease. And we see this again and again. Today in my office, I saw a woman with quite advanced stage lymphedema who came from over 2 hours away from upstate New York, who was referred by another patient who I was able to help. And she has a very, very significant case, and she was in tears with her husband in the waiting room after the exam because she was so happy that somebody finally listened to her, examined her, and made a diagnosis and gave her, as you pointed out before, this very, very precious word in healthcare, hope. And it makes me feel great when I can do that. But as long as there are so many physicians who are ignorant of this disease and group of diseases, including lymphedema, lipedema, Derkham's disease, etc., phlebolymphodema, lympholipedema, phlebolympholipedema, etc., all of the overlapping clinical scenarios. Well, as long as that continues to be the case, and the diagnosis is not being made again and again and again and again and coded again and again and again, and treatment requested, well, the insurance companies and the federal governments, ours and yours, are not going to take this entity seriously, and people are going to continue to go on suffering because they're going to have very little or no care provided because it's almost impossible to afford these things out of pocket, again, because it is a chronic and progressive disease that needs ongoing therapy, multimodality therapy that Monika so beautifully described, and you described yourself, from all of the various components, up to and including surgery. If the diagnosis is not recognized, then no one is going to cover surgery. They're going to consider surgeries cosmetic, and in the words of our recent guest, Dr. Fakhradian from the Mayo Clinic, experimental. And these things are not experimental at this stage of the game, especially in qualified hands and the hands of experts. So the point I want to bring out again, I was thinking about it today. One of the things that may help some patients, as we all know, is liposuction in the hands of the right surgeon, a highly qualified surgeon, especially in the case of lipedema. But if you don't recognize lipedema as a disease, then it will never be covered as a real medical surgical procedure. It will always be considered a cosmetic surgical procedure, and many patients simply cannot afford that kind of surgery. So this discussion, as always, inspires me to keep this show going, keep the guests coming, keep the discussion happening, because there's so much to do, so much education to do, so much awareness to bring forward. And I was thinking also, even in my career as a surgeon, thinking back to the days where no patient was considered, or extremely rarely was a patient considered a medical candidate for breast reduction surgery. But now we're seeing more and more and more that breast reduction surgery is being covered by insurance because there are real medical consequences of having these oversized, heavy, pendulous, etc. breasts. And that is a real disease process which needs to be respected, recognized, treated, and covered through health insurance. So if it could be done there, which they've made great progress, it can be done in this set of diseases. So I think that's an extremely important subject that you brought up.
Well, and I think too, it's funny because I do volunteer a lot of my time to be on lots of different platforms. I'm the vice president of the Lymphedema Association of Manitoba. I do other roundtable talks with other lymphedema forums, and I try to get involved. And I kind of, not to say got short on the last roundtable, because a lot of people will look at somebody like myself, who I have put my life onto social media. I obviously do advocacy. I try to do my best to encourage and inspire, but it's going to be a collective. And I'm very fortunate because I've had the opportunity to work with, Dr. Chuback and Dr. Gloviczki. I get to be a medium in between what I would consider the medical side in the medical field of lymphedema, but as well as to also represent the patients of the lymphatic world and really encourage everybody to come together, to take part, to work together. People who are sitting at home who haven't got a diagnosis or who have been sitting there for 30 years undiagnosed with these heavy, swollen legs with pain, whether it be lipedema or lymphedema, it's going to take all of us working together to make a difference. And for anybody sitting on this podcast right now, I really encourage you to take part, to link up with people and it's crazy when you say, I've never met more beautiful people in the lymphedema world until I've met the people in the lymphedema world. Everybody is so passionate. Everybody is just so kind, wanting to make a difference, and every voice matters. And so I don't care if you're coming from a medical background. I don't care if you're a patient. We need everybody to take part, because if we want to see a difference, it's going to take a unified voice to get the difference, to get the funding, to get the attention this disease actually needs. And this is such a loaded topic of conversation. Dr. Chuback, I should have known better. You're going to set me up and get on my passion going with these podcasts here, but it's true, right? Like, it's not just a single person making a difference. It's a matter of all of us really working together and linking up and just trying to get the education and get the government, get the health ministers to recognize that this is an actual huge problem and something needs to be done.
And the other thing that I would say, dovetailing again on your comment, picking up on a remark that you wove in there, and we come back to this again and again and again, and I think it's absolutely essential to reinforce it and to discuss it over and over. The massive psychosocial and emotional impact that this disease process and these diseases have on the sufferers. And that in and of itself becomes another clinical entity and diagnosis and scenario that needs to be addressed and needs to be cared for. And people need empathy, and they need compassion, and they need treatment in many cases. I mean, you said yourself, I mean, it's easy to listen to your story and easily filter out the idea that you mentioned that you were deeply depressed for 16 years. I mean, this is a tragic story to hear. Mental illness, emotional distress, depression, anxiety, these are real diseases. Another group of diseases that after 100 years still aren't getting the respect, recognition, and treatment that they deserve. So this is a complex problem. It's not just a physical problem. It's not just a dysfunction of the lymphatic system. It's a problem, again, as Amanda knows very well, affecting men and women, but women are oftentimes affected much more profoundly from the psycho-emotional, psychosocial point of view. And the woman today was in tears in my office, and she was ashamed to even show her legs to me. And I had to, of course, reassure her that I'm a physician and this is what I do, and there is nothing to be ashamed of, and that this is not her fault, and so on and so forth. We cannot lose sight of that enormous part of this clinical milieu, this group of entities that have such a massive impact on the lives of real people with real lives.
Millions of people, we have to add, because this is a disease with a huge prevalence all over the world, in the Western and in underdeveloped countries. This is always a huge issue.
I agree. And thank you so much for putting this podcast together and just for having us. And we always have such good conversations, I find. And it gets me really motivated and fired up again, because again, change isn't going to happen overnight. But it's super amazing to link up with other people who have that same vision and that same, attention to detail, that this is an epidemic. This is a global issue. But again, we can't just sit back. So thank you for doing this LymphCast, Dr. Chuback. I really appreciate it.
Well, it's my great pleasure and my privilege to be a part of it. And, I learn so much each and every time we bring another guest on, and I learn always from the other panelists. And it's an honor to be a part of it. But I want to comment on something that Monika just said, which is we have to take this into consideration. We're talking about millions and millions of people around the United States and around the world. And so think about how business people, insurance providers, et cetera, the federal governments and so forth, health agencies, think about the financial terror they must feel to consider, oh my goodness, if we really recognize these entities as disease, what the massive cost of that might be. So being a little bit cynical and skeptical, perhaps, but you hate to wonder how much of this neglect or denial on their part is intentional.
Yes, but it makes me angry because I'm so conscious that in fact this is a stupid thinking, because if you diagnose and treat this patient early, the cost is incomparable with the cost of the huge disability of patients with elephantiasis without even an option to work or to have a normal life. So once again, I think it's the short sight understanding. If you say that this is such a financial cost from the very prosaic point of view.
Agreed.
Because actually the sooner we treat, the lesser is the cost. It's like with hypertension. If you treat the patient with the hypertension, of course there is a cost, but if you take it early, probably you prevent a thousand of complications, you prevent the stroke, and you save life.
Agreed. But remember, when people are, as we all know, when people are creating budgets and people are looking at profits and losses and spreadsheets and so on and so forth, it's often much easier to kick the can down the road and say, well, let that be somebody else's problem.
Sure.
Which is so sad, but these are the realities that we deal with, and we have to continue to fight against.
And Amanda, I would like to thank you on behalf of all patients with lymphedema, because I think that the work that you did, it's absolutely amazing. And I invite everybody to go to YouTube, to go to the, first of all, Amanda website, because that's very instructive, but go to YouTube and see all the material that Amanda is sharing with another patient, with the lymphatic drainage method, with brushing method, with all kind of advices that she is giving for free to everybody who is willing to take care of their lymphedema problem. And I think that's, thank you.
Thank you. I have free downloads on Facebook and on Instagram. I have free consultations. My door is always open. I think the biggest thing that I get from my clients, or just even my followers, is just they're so relatable. Like, they finally are able to sit, and because I live, eat, breathe, sleep this condition every day, it's so nice to be able to talk to someone who's not only experiencing those symptoms, but also has come out on the other side of it. So again, I try my best to offer support, guidance, inspiration, motivation, and just let people know that they're not alone. And I sincerely love what I do, and I've taken all of my pain and I've turned it into my passion. And I just thank you so much.
We are thanking you for participating in that LymphCast. And please continue what you are doing. I hope that you will join us maybe another time for another vodcast or podcast. And
I just like sitting with you guys. You can have me on as many times as you want. I'll just sit here and look pretty, I suppose.
You said it, not me. We'll take you up on that offer. Paul, do you want to sign us out?
I sure will. Why don't we have Amanda put out her website again? I know you have free consultations, at least initially. Maybe just tell people how they can get a hold of you and find you and interact with you a little bit more for all the great things that you do.
Sure. Yeah, no, my website is amandasobey.com. So S is in Sam, O, B is in Bob, E-Y. You can go hit up my website. I'm also on Instagram and Facebook at am.sobey. And I do have my YouTube channel that I try to put on my exercises and just other techniques. And if anybody wants more information, just feel free to send me a message. It's easy to get a hold of me.
Okay, very good. Thank you very much. Again, our special guest today, Amanda Sobey. Amanda, thank you for being here. And as Dr. Gloviczki and Dr. Chuback have intimated, we'll have you back on. Thank you very much.
Thanks so much, you guys.
You bet. Also from Arizona, Dr. Monika Gloviczki. Thank you for bringing Amanda in. Thank you for participating. We'll see you next time.
Thank you. Thank you. See you next time.
All right. And the founder of this show, as well as Vita Support MD, physician surgeon from New Jersey, Dr. John A. Chuback. Thank you, sir. Dr. Chuback, thank you very much. And we will see you next time as well.
Pleasure as always, Paul. Very thought-provoking, stimulating, and I thank you for your good work and encourage everybody to come back and join us again. We have an unbelievable lineup of guests that Dr. Melin and Dr. Iker and Dr. Gloviczki, and to whatever extent that I can help, have lined up. And there's a lot to learn, a lot to share, and I think it's a marvelous experience. So thank you once again, everyone.
All right, excellent. This has been LymphCast, episode number 8. We will see you next time for obviously episode number 9. Thank you for watching and listening. We will see you next time.